Educating yourself about your family's medical history is one of the most empowering and actionable steps you can take in the journey of cancer prevention. While many cancers arise sporadically due to lifestyle, environmental exposure, or age, a significant percentage, estimated at 5–10%, have a hereditary component. Understanding your genetic predispositions enables early detection, tailored prevention strategies, and informed lifestyle decisions that could ultimately save your life or the lives of those you love. It shifts the focus from passive risk to proactive health stewardship. At its core, family history serves as a window into your biological risk landscape. When close relatives, especially first-degree family members like parents, siblings, or children, have been diagnosed with cancer, particularly at an unusually young age, or if multiple family members have been affected, it may suggest the presence of inherited genetic mutations. Some of the most well-known include mutations in the BRCA1 and BRCA2 genes, which dramatically increase the lifetime risk of breast and ovarian cancer. Others, like those found in the Lynch syndrome family of mutations, are linked to colorectal, uterine, and other gastrointestinal cancers. These mutations don't guarantee that cancer will develop, but they significantly raise the probability, making proactive measures even more essential. The beauty of knowing your family history is that it gives you time and direction. If a hereditary cancer syndrome is suspected, genetic counseling and testing can clarify your personal risk. This information can then guide decisions about when to begin screening, how often to be checked, and what methods to use. For instance, women with BRCA mutations often begin breast cancer screening as early as their 20s or 30s, using both mammograms and MRIs for greater sensitivity. Some may also consider risk-reducing medications or preventive surgeries. Similarly, individuals with Lynch syndrome may undergo colonoscopies every 1 to 2 years, starting well before the general population's typical screening age. These early interventions often catch cancer at its earliest, most treatable stages, or prevent it altogether. Beyond medical screening, understanding inherited risks allows for smarter lifestyle choices. If you know you carry a mutation that increases cancer susceptibility, you may be more motivated to maintain a healthy weight, avoid tobacco and excessive alcohol, and adopt an anti-inflammatory diet rich in vegetables, fiber, and antioxidants. You may choose to be more diligent about sleep, stress management, and environmental toxin exposure. In essence, knowledge becomes the catalyst for a more intentional, protective way of living. Importantly, uncovering family history also allows for a ripple effect of prevention within families. When one person learns of a hereditary risk, that information can be shared with siblings, children, cousins, and other relatives who may benefit from screening and testing. This creates a culture of vigilance and empowerment across generations, a network of people no longer walking blind into potential health challenges, but instead equipped with tools to intercept disease before it takes root. Gathering your family history doesn't require advanced technology. It begins with conversations. Ask relatives about their health, focusing on what types of cancer they've had, how old they were at diagnosis, and any patterns across generations. Write this information down and share it with your healthcare provider. From there, you may be referred to a genetic counselor who can assess whether testing is appropriate and help you interpret results with accuracy and compassion. In a world where genetic medicine is advancing rapidly, your family history remains one of the most accessible and effective early warning systems available. It bridges the gap between the past and the future, allowing us to learn from what has happened in order to shape what happens next. When we choose to become students of our own biology, we open the door to prevention, early detection, and peace of mind. It's a choice rooted not in fear, but in foresight. And in that choice lies one of the most powerful tools for reducing cancer risk: awareness that leads to action.